can you just give us the facts? And then I really want to ask you about your concerns about the president going with his hunches, disputing the World Health Organization and the CDC.
So the facts are clear that right now the risk to the average American in our country remains low. But there are actions that we can take right now to protect ourselves and our families. They're pretty basic, like washing our hands, making sure that we're sanitizing our hands and commonly touched surfaces, making sure that we get a flu shot because the flu is still circulating in our communities right now. We don't want individuals to get sick with the flu and with the coronavirus. It's really important that the American people take the opportunity to consult trusted sources of public health information like their local public health departments and like the Centers for Disease Control and Prevention.
Is there any danger, or do you think that once you've told 16,000 lies, people sort of take it with a little grain of salt? Is there danger in Donald Trump going on Fox News and telling that network's viewers that, you can go to work, I don't believe the WHO, I disagree with Tony Fauci on vaccines? I mean, is it dangerous to have conflicting messages out there around a potential global pandemic?
Well, it's certainly not helpful. Right now, we should all be encouraging the American people to prepare and not panic. And so I've been in touch with my local public health officials in Northern Illinois, making sure that their priorities were reflected in the supplemental that we just passed here on Capitol Hill this week. And I think that as we do this work, we have to offer facts and then a reassuring message to say that we're all in this together, and that even as an elected official myself, I'm consulting with the experts at the CDC, participating in the briefings that they've offered us members and making sure to relay that information to my community at home.
Congresswoman, obviously this story exists for most Americans parallel to the Democratic primary contest, which is getting pretty intense at this point. Any thoughts on the results of Super Tuesday, and have you made an endorsement?
I've not made an endorsement. I am continuing to track the election closely. Our primary in Illinois is in 2 weeks, and so our vote is going to matter, which is, something that's very exciting for us and the constituents that I represent. But more broadly, I do think that it's important for the American people to take the opportunity to head out and vote. This is not just a vote for who's the commander-in-chief and who's the president, but who's going to lead our country forward during times of consequence like these. And so I'm certainly going to be keeping it all in mind when I head to the polls.
Congresswoman Underwood, thank you for spending some time with us. It is interesting, Kim, that these two, we separate things out, right? We cover these stories and we separate them out. I think, and I feel the same way about impeachment, I think voters are going to the polls thinking, and I take the Congresswoman's word and the CDC, and we're lucky that there is a low risk to most Americans for contracting this disease, and even a lower risk of it being something life-threatening. But there is something in that turnout. There is something in those lines that we saw Tuesday night that when the stuff gets real, maybe we don't really want him there. And to me, when you talk about electability and you look at this crisis, it does seem to be sort of intermingled in ways that the polls and the coverage doesn't always reflect.
I think that's absolutely true. And even in ways that it does reflect. I mean, we've been hearing from the beginning for election season after election season that health care is the #1 concern of voters because that's something that affects them. They've been sick. Their children have been sick. They know what health care costs. They know what it's like to have to take time off of work. So these are very real things, tangible things. We can talk about foreign policy and we can talk about tweets. These are things that are affecting their daily lives. And so you have something like this virus, which, yes, even if the risk is low, the impact isn't. It's scary to know that there is an outbreak, but they're also feeling it economically. They're also having, people are having conferences canceled. I was at DCA the other day. It was empty. It's a scary time, and that does motivate people.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.